Now, it is my pleasure to introduce the author of the brief we will be launching today, Elizabeth LaRue. Lisa is research director at the Unit of Religion and Development Research at Stellenbosch University. She has, over the past 12 years, secured funding and delivered a range of evaluation and formative research projects in 24 countries across 4 continents, with a particular focus on gender equality, gender-based violence, women's participation, and a critical lens on the important roles of religion and culture. Lisa, the floor is yours.
Thank you so much, Danielle, and thank you, everyone. It's such a privilege to be with you today and to discuss this some more as a group. Thank you for this opportunity to give you an overview of the research that I did with the UN Trust Fund on survivor-centered multisectoral service provision to prevent violence against women and girls. And like Danielle said, I think a big thing that I hope you will see in this 50-minute interview is that this piece of research really contributes to the debate around the link between prevention and services, specifically through that lens of civil society organizations. Next slide, please. Now, at the heart of the synthesis review are the practitioner insights from 8 civil society organizations, or CSOs, and they were all implementing violence prevention programming. Responding to the needs of survivors was, for all of these organizations, their entry point into preventing violence against women and girls. The 8 CSOs were selected to be part of this brief, not only because they aim to improve and provide and bolster services, but they also did so in a way that was survivor-centered and relied on multisectoral collaboration. Now, I learned so much from these 8 organizations, so please allow me to name all 8 grantees, because the learning that we share today and in this brief is theirs. It's the Free Yazidi Foundation in Iraq, Medical Services Pacific in Fiji, Organización Nacional Indígena de Colombia, or ONIC in Colombia, Panzi Foundation in the DRC, World Hope International in Cambodia, Shehab in Egypt, B92 Fund in Serbia, and Physicians for Human Rights in their work in the DRC and Kenya. Next slide, please. Now, this conceptual framework that you see on your screen was designed in the aftermath of the inductive research process, and is based on the practical learning that emerged about how and why civil society organizations design and implement services for survivors. It's also designed to be a tool to help increase our understanding of CSO service provision. Now, if you look at the middle of that sketch, of that figure, you'll see the precariousness of that oval balanced on the 3 triangles. And that represents that the provision of services by CSOs, it relies on 3 key elements. So an integrated view of prevention and response, a survivor-centered approach to service provision, and multisectoral collaboration. Now, providing services is challenging, and it requires a balance between these 3 elements. And this balancing act is put at risk by 3 challenges, as you can see on the right on your screen. And those 3 challenges are the absence of state service provision, the lack of recognition and status for civil society organizations, and then resource challenges. Now, as I said, the 8 grantees included in this brief, in the synthesis review, they provided services and/or capacitated other service providers. And although such service provision is much needed, there is potentially negative consequences to civil society organizations that provide these services. And that's highlighted to the left and the bottom of the figure. The first is that state actors are not held accountable, as CSOs are stepping in to fill the gaps that state services are supposed to provide. Second, the CSOs risk losing sight of primary prevention, especially when providing services is in high-risk settings. And then the overburdening of CSOs, including volunteers, since these organizations are operating on small budgets, and yet they're trying to address these really comprehensive needs. So I will now give you a brief overview of the findings that emerged in this study. Next slide, please. Now, grantees revealed that they view prevention and response as linked and mutually reinforcing. So their work with and for survivors is an important element of prevention, and activities that we typically associate with primary prevention are a crucial element of response. So prevention and response, they exist along a continuum, with grantees doing both prevention and response activities as part of their EVAWG programming. So for example, MSP's mobilized clinical outreaches in Fiji not only served survivors, but it also brought services to all women in marketplaces and remote communities, and provided healthcare and information to help prevent at-risk women from experiencing violence. Now, while some grantees explicitly designed their programming focused on survivors to also have a primary prevention component, for other grantees, they work with survivors organically evolved into kind of including some form of activity or activities more directly focused on primary prevention and preventing violence from occurring in the first place. We also saw that high-risk settings may impact how a grantee places on this prevention response continuum. So in high-risk settings, I think conflict, for example, the urgent and immediate needs of survivors, and then that absolute lack of services that are available to them, may lead to a grantee choosing to only engage with survivors and not do any prevention activities. For they're confronted by this moral ethical dilemma, where how can they prioritize and focus on primary prevention activities in the light of these very immediate needs of survivors. Next slide, please. We're now exploring the second finding around survivor-centered approaches to, Sorry, can I continue? I just heard someone speaking, was that just me? Okay, so around the second finding. The grantee projects revealed that survivor-centeredness can be present in different elements of service provision based on who was included, how they were included, and what the project strategies were. So if survivor-centeredness takes on these different forms within different organizations and projects, we again see survivor-centeredness also lies along a continuum. So at the one end of the continuum, organization is survivor-centered as long as it prioritizes responding to survivors' needs. But these survivors remain only beneficiaries. Other end of the continuum, survivors are active participants in the design, the implementation, and the learning connected to EVAWG programming. We also see that a program is best positioned to be survivor-centered if it includes and even centralizes survivors in design and implementation. And what the grantees also emphasized is that the experiences, needs, and insights of survivors should be guiding primary prevention activities as well, not only service provision to survivors. What really stood out from engaging with these grantees is that survivor-centeredness is not a goal to achieve. It's rather a continuous process or journey. And these CSOs were constantly interrogating what it means to be survivor-centered. And they were striving to improve and evolve and become more survivor-centered in their design, but also in their implementation and learning. Next slide, please. Now, the third finding is around the wide-ranging impact of civil society services. All of the projects discussed in this brief were designed to fill gaps, build capacity of, or bolster existing services. But in ensuring that survivors receive the services that they need, we saw that this distinction between general services and specialized services, it became complexified. So some grantees provided specialized services, but they provided it to both survivors and the community at large. While other grantees provided general services, but they tailored it to the specific needs of survivors. And then we found other grantees that just intentionally focused on strengthening general services. And seeing this reality, it challenges this notion that civil society organizations can only be involved in specialized services. Furthermore, those that were working in resource-challenged settings showed us that it may not be realistic for a civil society organization to attempt extensive, holistic, integrated service provision, such as we would see, for example, in a one-stop center. Even though such integrated services are sorely needed, it is the realities of providing it in such a setting makes it very often just completely unrealistic. And this means at the same time, though, that these civil society organizations are pulled in two competing directions in terms of service provision. So on the one hand, they want to provide, or they should provide, one or two services really well, but at the same time, they really want to respond to all the needs of survivors. And this is a challenging situation to be in. Then interestingly, a community volunteer element was an important part of service delivery in all of the projects, and they did very different things. And still we saw community volunteers being present everywhere. And these volunteers, again, also emphasized this link between services and prevention. So for example, ONIC's project in Colombia capacitated indigenous women volunteers to accompany indigenous survivors. So they created this pathway of accompaniment and support. But we saw that the volunteers not only accompanied survivors, they also advocated around violence prevention in their communities. Next slide, please. Now, all of the projects relied on some form of multisectoral collaboration. But, and this you really need to pay attention to, these civil society organizations were not always simply partners within the multisectoral collaboration created by other stakeholders. Very often, these civil society organizations were the ones starting, coordinating, and leading the multisectoral collaboration. And these collaborations were crossing different sets of sectoral boundaries. So between stakeholders at local, national, and international level, but also between stakeholders from government, civil society, and or private sector. And we also saw it between stakeholders from different disciplines or areas like health or education or justice. We saw that the multisectoral collaboration by grantees were focused around three main domains: the training of different service providers, establishing referral networks and ensuring that survivors are well treated at different service points, and then advocacy around violence against women and girls, survivors, and their needs. Again, we also saw that multisectoral collaboration activities integrated prevention and services, with each strengthening the other. So for example, B92 funds economic empowerment programming capacitated survivors in government safe houses, but also at-risk women and women in general from local communities. Then grantee experiences highlighted the challenges of creating multisectoral collaboration only between individuals and not between the institutions that they represent. So individuals may face resistance from their own institutions where they work if they engage and prioritize multisectoral collaboration. And this emphasizes the importance of also including and mobilizing institutions in such collaborative endeavors. Next slide, please. Now, COVID-19 brought obviously, many additional challenges to grantees who
2 minutes,
hope to
please,
assist
Lisa.
survivors.
2 minutes.
Many services were no longer available due to COVID-19, yet survivors' needs remained and often increased. We also saw that COVID-19 highlighted the importance of having specialized services recognized as essential services, because where specialized services that CSOs provide to assist survivors are not recognized as essential, these civil society organizations can't continue service delivery when government places travel restrictions on all but essential services. Next slide, please. Now, to end us off on, the report discusses a series of recommendations for practitioners, policymakers and donors, and researchers. And I have like 60 seconds left, so I'm going to run through this quite quickly. Recommendations for practitioners include developing and continuously adapting EVAWG programming, aiming to become increasingly survivor-informed and led. Second, exploring the possibility of taking the lead in creating and leading and managing multisectoral collaboration around service provision. 3, avoiding binary views of prevention and response when designing EVAWG programming. And then 4, recognizing that community volunteers can be an important element of service provision, but then also ensuring that they're carefully selected, trained, and supported. Next slide, please. Now, for donors and policymakers, it's recommended that you design policies and funding in ways that allow practitioners flexibility, that they can integrate prevention and response. Second, that you recognize that CSOs can be the ones to create, lead, and ensure multisectoral collaboration. 3, to fund CSOs, including women's organizations, as they're filling significant gaps in service provision and multisectoral collaboration. And then 4, developing policies and fundings that support the economic empowerment of survivors, which is a strategic space to enhance the linkage between prevention and response. The next slide and final slide, the recommendations for the EVAWG research field include conducting more research on CSOs and their role in service provision, developing research and evaluation methodologies that can engage with an approach to EVAWG that integrates prevention and response. 3, exploring the prevention and response continuum and investing in evaluations that can deal with this. 4, conducting more research on the role of CSOs in multisectoral collaboration, and specifically in creating and leading it. And then 5, conducting more research on survivor-centered approaches for prevention programming. Now, that's it for my brief overview. Please allow me to again say it was such a privilege to do this piece of research that really centralized those who are actually providing services and that I was able to learn from them. Thank you so much.
Thank you so much, Lisa, for your presentation. This brief is now available on the UN Trust Fund website via the link in the chat. You can also scan the QR code on your screen to access the publication from your mobile device.